Yeah, I came here to do the recording because I think it's important that we connect with the community. Sometimes we get busy with our day-to-day things and we connect with a small portion of the community. But there's a lot of people who have concerns or symptoms and varied individual issues. And so I think it's important that they know that we're available. We're still here as the medical community, and that we're available for them and help answer their questions and take care of them. We see a wide variety. 65 and up, yes, a lot of those folks benefit from our assistance, but there's a fair amount of people who have either active heart disease or lots of risk factors who are interested in getting their hearts checked out, at 40 and higher. So we are available for all of them, and we try to take each person's individual concerns and tailor our thoughts and plans in relation to what they're worried about. The primary care is really the gatekeeper for a lot of people to build that relationship and build that trust. So when they recommend some of these evaluations, that the patient is on board with it. And then, when they do come to us, it's important that we continue to help foster and build those same types of relationships. So, I think people who have symptoms definitely don't want to ignore them and want to come in and get evaluated right away. But the other main population of people that I think benefit from an initial cardiac evaluation are people with a lot of risk factors. And even though they feel well, it's always a good idea as we move on in life and we start developing risk factors to get a second opinion, get a second pair of eyes to kind of look at things and see, is there ways in which we can help optimize your overall health to limit the risk? Prevention really is the key moving forward, both for people who have never had an event related to cardiovascular disease and people who have had them. Prevention is really important. It's the foundation to helping live a long, healthy lifestyle. And so a lot of times that just comes with building those relationships and then having that sounding board to remind you once a year or twice a year, what are the things you can do to remain healthy. So if someone benefits from, frequent evaluations, we're always available and helpful in that sense. And if they're doing well and we just need to check in with them every once in a while, that's great. That's what that's the key to prevention. Common risk factors that we know about in the community: diabetes, high blood pressure, cholesterol, tobacco use, obesity. These things are prevalent in high numbers across our country and in our state and in our city. And so these are some of the things that we can manage and deal with that will really make a benefit down the road. And so when we talk prevention, these are the concepts that we are looking at. These are the things that are important for the people, and this is where we get tailored, to the individual, because not everybody has all of those risk factors. But when you do have them, it's really important to focus on those and find ways that we can manage those that fit within individual lifestyles.